Healthcare workers and nurses play a crucial role in our system. This nurse, with decades of union experience, highlights the flaws in our current healthcare setup and explains why a state-by-state approach to single-payer is problematic. As a retired union worker with healthcare experience, she witnessed how the for-profit model fails workers and patients. National single-payer is the ultimate goal, but attempts at state-level reform face significant obstacles. The nurse mentions past attempts at healthcare reform, such as the Clinton administration's push for HMOs and the Affordable Care Act, which kept profits in the system. These plans fell short of true single-payer ideals. On a state-by-state approach, the nurse compares it to workers' compensation, where differing state tax systems lead to competition and a race to the bottom. This approach often undermines the goal of comprehensive, equitable healthcare. The nurse highlights the misconception that Canada's single-payer model, which started in one province, is a viable model for the U.S. The structural differences between the two countries make this approach difficult to implement. Federal regulations and laws like ERISA complicate state efforts to implement single-payer. Without a unified funding stream, states struggle to establish a comprehensive system, leading to inefficiencies and gaps in care. Ultimately, the nurse advocates for national single-payer as the best solution. National healthcare reform requires a unified effort, focusing on removing profits and barriers to care to ensure access for all. This discussion aligns with ongoing efforts to build public support for a national single-payer system. It underscores the importance of collective action and policy change to create a more just and effective healthcare system. Despite the ongoing fight for Medicare for all, whether on a national or state level, there exists a dire need for basic federal human rights for all workers. This includes the urgent establishment of a National Workers' Compensation Commission, ensuring the rights and welfare of workers across the country are protected. It is critical that these federal issues be on the tables of all lawmakers. Thus, the fight for healthcare reform must also include a fight for basic federal human rights and a National Workers' Comp Commission, creating a comprehensive approach to health and worker rights.